All right, so for my business model, I decided to go with a pharmaceutical corporation. I'm going to call it Dermativity. What this company is it sells dermal healthcare products. The whole idea of it is to take pharmaceutical products on today's market and make them so that I can change them and make them so they're for dermal use. So instead of injecting a vaccine per se in your arm, instead you just rub a cream on it. And why I'm trying to do that is because, well, some people have inabilities where they can't take an injection in the arm, or some allergies exist out there, so where they can't get vaccines or certain medical care. So the whole goal about this project is to be able to reach a wider margin of people out there who can use a dermal product, but also, I mean, in today. The reputation vaccines have in today's world is not the greatest, and so being able to have a product you can rub on your skin and absorb rather than inject in your body, the whole idea of that is to uphold the reputation and still deliver the same product the vaccines do today. As far as key partnerships, obviously all the vendors and manufacturers that would supply the things that my business would need are very important. You got your plastic, your glass, your rubber, equipment, that sort of thing, and then maintenance things, oil, and then being able to have testing stuff, being able to test on animals. And these are just examples of companies that I listed that would be possible partnerships I could use. As far as activities, we'd focus on research, development, production, distribution, any big manufacturing companies would deal with. A lot of resources we would use, definitely plastics, bottling per se. We're putting the cream, the product into a plastic bottle, and so we're going to definitely be using a lot of plastics. Glass is definitely used for growing the product, being able to put the product in the cream. Glass is definitely going to be used for growing that sort of thing. Rubber, obviously gaskets, that sort of thing, making sure bottles are sealed. And then just utilities in general. We're gonna go through a lot of gas for heating the boiler rooms, steam, cleaning, make sure all the pipes are clean, we use steam, make sure everything's aseptic. Value propositions. So what we would definitely offer to the things in the industry right now. Hospitals, wholesalers, retailers, government agencies, physicians, veterans, and patients. All of those are very important into the medicine economy. So what we'd offer compared to other companies, as far as hospitals, we're giving exclusive products to them that they would need right away. Wholesalers, we're going to be able to hopefully keep up with the market and the high demand. And so those wholesalers are definitely ordering large amounts of products. And so the whole goal is to be able to meet that demand. Retailers, giving our product, sending it out to them so they can supply the right types of products, and obviously figuring out what retailers would need certain products that we'd make, figuring all that out as well. Government agencies, making sure that, keeping up with all the rules they have in place in the medicine market, making sure they don't go to waste. Physicians, obviously, discount rates them. They're individuals, they're running their own firms. They're not going to be able to have the big high dollar signs that we could offer to others. Veterinarians, obviously, high quality service to the pets at home and the livestock on the farms. Patients, just being able to buy something over the counter and not have an appointment is definitely a lot easier. Relationships, marketing, customer service, joint ventures, and licenses. What I mean with that is kind of down here. Oncology, kind of franchising out, honestly. Having exclusive places where people can go to and get our product. And that's definitely something we can make a little bit of money on. Channels, obviously, our website, social media platforms, commercials, government usage, investment from large firms. Definitely startup costs are definitely going to need a little bit of investment, but also get our name out there, especially build that trust that certain firms have standards. Customer segments, like I said, these are the segments. I just added what we bring to the table for those segments. As far as what we're definitely going to incur cost-wise is just our startup costs, licensing fees, getting our business up and running, getting the government to be able to come in here, audit everything. It's definitely going to be something it's going to cost a little bit of money. But as far as our manufacturing costs, once we get up and running, they will plateau out once we get going. Production costs just similar. Just you add in employee wages in there. Research costs, developing product takes years to get to the market, and we know that. But that's a big part of it. But that is what makes the product what it is today. Administration, just setting up structure, seeing how we want the company to work. HR, stuff like that. Insurance, making sure the company's secure, we can't get sued and lose everything. Material costs, equipment, waste management services. Chemical waste is expensive to get rid of, so that is definitely something that we'll have to work out. Utility services, OPPD, that sort of thing, what you have in your house, just the water, gas, stuff like that. Obviously, USDA approval is going to be a big thing. If you don't get that approval, then you can't get your product to market. So that's a huge thing we're going to be working on, making sure we can keep that approval for all of our products. Marketing, ads, and website development, that shouldn't be too difficult as far as cost structure compared to the other things. But where we do make our money is right here in the revenue streams. Pharmaceutical products. These are going to be products that you can get over the counter, stuff that we can sell out to Walgreens and CVS, those sort of things where you can go every day and pick up something. So those are definitely going to be huge because it'll cut out the cost of paying distributors, and we'll make some good money from there. As far as where we do make our money product-wise on the wholesalers, just the human side and the animal side of things, both of those are just going to go straight to distributors. Definitely going to make us a lot of money because there's a huge demand in those areas. And then, like I said earlier, the oncology, kind of just franchising out and getting these little facilities running up so we can exclusively hand out our product. But other than that, that is the business model for Dermativity. Thank you.